All new at 11, members of the Georgia congressional delegation are asking the Food and Drug Administration to explain why there's a cancer drug shortage. The effects have left patients with fewer options for treatment for months now. Teresa Bowles found out how it's affecting a McDonough man fighting cancer. Teresa, how did this happen? How did we get here?
Well, Jennifer, a huge manufacturing plant in India shut down, causing a shortage of several drugs that can be used in place of IV chemotherapy. And now some patients are forced into a situation where they can't choose. James Jones says standard chemotherapy wasn't nearly as bad.
It is the worst decision I ever made.
When compared to the alternative.
I felt like I was somewhat forced to take the pump.
It's a device that dispenses chemotherapy drugs into the body at a slow, controlled rate. Jones has been fighting rectal cancer for almost a year. Once he finished chemo, he was slated for radiation and then was supposed to take chemo through medication. Instead, he was hit with yet another curveball.
They said they had a nationwide shortage on the pill. I asked them, when do you think you would have it? They said we probably would have it in a couple weeks. A couple weeks came and went by, no pill.
Here are some of the cancer drugs affected by this shortage. All year, tons have been in short supply. Jones needed capecitabine, and because he couldn't get it, the pump was the next best thing. He felt its effects immediately.
I mean, it's grueling, so painful. After a while, you're hurting, and you just want some relief. But that pump, there's no relief.
Making it harder for him to enjoy the simple things with his family.
The wife would like to say, can we go to dinner or go eat or do something? I'd be like, I'm sorry, I can't go.
Jones had to wear the pump at home 7 days a week.
Maybe the pill would have been a little better.
TheCancerCenter.com says some patients find their side effects are less severe with the pill. And though the FDA says it's working on solutions, Jones wants them and Georgia lawmakers to take it a step further to prevent anyone else from going through the pain that he did.
Create a team designated specifically just for this purpose.
The good news is James says he finished with the pump 2 weeks ago, and though he's still dealing with some residual symptoms, he's got great support through his family and his faith.